Hello, class. This is Mrs. Woodruff, and I'm going to try again for the fourth time to record your lecture for Chapter 9, Non-Communicable Diseases. I did it before, three different occasions, and when I completed it, there was no audio, so I'm going to pray that this one works. Your Chapter 9, Communicable Diseases, begins on pages 218 and goes through page 238. And the last 3 or 4 pages of that are included in references. So your learning objectives for this particular chapter include describe the impact of non-communicable disease on the health of a population, define the burden of non-communicable diseases using current epidemiological frameworks, describe the risk factors at the individual and population level related to the development of non-communicable diseases, and then finally apply current evidence-based population interventions to the prevention of non-communicable diseases. Before we do anything, though, we need to define what is non-communicable diseases. And these are diseases that are not passed from person to person, directly or indirectly, and are not caused by an infectious agent. And this is the definition that's in your textbook on page 218. These are generally attributed to modifiable risk factors such as behavioral risk factors and environmental risk factors. Modifiable risk factors are those conditions that can be changed by either primary, secondary, or tertiary interventions. These would include things like nutrition, addressing limited or no access to healthy food choices, and this would address problems with obesity, diabetes, and possibly heart disease. Additionally, behavioral ones include exercise and physical activity. So our interventions will be aimed at addressing limited or no access to places where people can engage in physical activity, or even address their failure to participate in activities if they are available, so that they can reduce those things that are associated with diabetes, obesity, and heart disease. Tobacco and alcohol use. This would include including drug misuse. So the belief is that if they can control or cut down or even eliminate tobacco use or alcohol use, then they will inadvertently be able to not have any of those non-communicable diseases that are associated with those particular behaviors. This would include like respiratory illnesses and disease, chronic maybe liver disease and heart disease, cardiovascular things, which can also lead to cancer and pulmonary conditions. Environmental risk factors include pollution, chemical exposures, and this could be in the home or even in the workplace. So the pollutants in the air and those chemical exposures could also increase the risk for asthma, cardiovascular problems, and also can contribute to the development of some cancers. So the impact of non-communicable disease includes increased healthcare costs, increased risk for chronic illnesses, and increased mortality and morbidity rates. This would include the quality of life and productivity. It can decrease life expectancy, increase the likelihood of disability or even the early onset of disability, and also premature death. So these are generally like conditions that are long in duration. They usually have a slow progression. They require medical attention over time and increase healthcare costs and the cost of health insurance premiums. They may also require extended or lifelong therapy, which we're talking about long-term care, either in the home or maybe even in a long-term care facility. They tend to limit one's ability to perform their activities of daily living, which can also increase the cost associated with care. Individuals may need assisted living at home. They may need maybe assistance with activities of daily living, and even go into their savings if they have to be placed into some type of facility where they're going to get skilled nursing care. In addition to that, the impact of non-communicable diseases will increase the likelihood of premature death. So life expectancy is the number of years a person can or could expect to live based on the current mortality rates in a specific region setting, and they usually identify this by country. This definition is found on your page 220. Then we think about the health adjusted life expectancy. This is the number of years a person could expect to live in good health by adjusting for disease and or injury. And remember we talked about injury with relationship to chronic diseases, and we're talking about injury with regard to respiratory illnesses or maybe falls or things of that nature. Therefore, an example could be that if one was healthy person, non-smoker, non-drinker, and lived in a reasonably good neighborhood with access to healthy food, physical activity, adequate health care, one could maybe expect to live for an extended or longer period of time. However, if they developed some non-communicable disease or they were injured, which was leading to a chronic condition, this would affect their um, life expectancy. And so you'd have to adjust their potential life expectancy based on those factors. Years of life lost, and this YPLL is the number of years of life expectancy subtracting the number of years lived at the time that a person was deceased. This is also an impact of non-communicable disease because it causes an early demise or premature death, or it could even lead to early disability based on whatever the non-communicable disease was. In the instance of maybe COPD or emphysema, you could be a person could be classified as disabled because they're now dependent on some respiratory support, and so they can't go out and do the things that they would normally do. They may be bound home by having to use oxygen or something of that nature. So the leading cause of death and disability. So your book talks about 7 of the top 10 leading causes of death in the United States are from non-communicable diseases. So the top 10 are listed here. This would include your heart disease, cancer, accidents, and this will be unintentional injuries, could be motor vehicle accidents. This could be accidents related to substance misuse, alcohol misuse, things, injuries in the workplace, and so forth and so on. Chronic lower respiratory diseases such as COPD, stroke and cardiovascular disease, Alzheimer's disease, diabetes, influenza, and pneumonia. Hence the reason why it is so incredibly important for people to get their flu shots, and for older individuals, those older than age 50, to get that pneumonia vaccine. Nephritis, nephrotic syndrome, and nephrosis is also a leading cause of one of the non-communicable diseases, and this is really related to excess use of alcohol that leads to the problems with the kidneys and the liver. And then we have to also consider intentional self-harm, and this would include the increased risk of suicide. So the burden of non-communicable disease. So the burden of non-communicable disease are all those things that we just talked about. Increased insurance costs, premiums, increased costs of treatment, especially for treatment of chronic diseases that are going to be lifelong things that will probably need to be maintained and will increase healthcare costs over the length of the person's life. Also, decrease access to affordable care. Hence, the reason why it is so important for the Affordable Care Act to stay in place, because millions of Americans rely on that affordable care to be able to have access to insurance, access to health care, preventative services, immunizations, and things of that nature. So risk at the individual and population level. So individuals will have multiple risk factors, including cardiovascular disease, cancers, chronic respiratory diseases. We talked about COPD. We talked about diabetes and how medical management of diabetics, especially those with type 2 diabetes, because those numbers are steadily increasing as obesity rates are also increasing, and then respiratory diseases. Individuals at highest risk have the lowest resources, and that came from your textbook, and that's very profound. If an individual is at high risk, and they do not have the resources that are needed to manage some of these conditions, these multiple risk factors, then they will have a decrease in their outcomes. So this refers to diseases that are not passed from person to person, like we said. So when we think about cardiovascular disease, it's low progression, long duration, accumulated risk, often from overuse of tobacco, heavy alcohol use, damaging the cardiac muscle. Um, and then inactivity. Remember that the heart is a muscle, and if you do not exercise a muscle, muscle gets weak, right? And it's not going to do what it needs to do. So it's not going to be as efficient and effective as it needs to be. We also have to think about eating habits and dietary habits and nutrition, and some of the foods that are high in cholesterol and fatty things that affect the heart and affect the heart muscle, which that hyperlipidemia can also lead to cardiovascular issues. Cancers for which treatment can be costly. Um, we can have to consider those that are not modifiable, and we talk about genetic predispositions. Early detection, diagnosis, and treatment options can have a huge impact on survival rates, but can also create a huge financial burden for families and for care facilities who may have a larger rate of clientele with no insurance or low insurance coverages, which are not available to treat any pre-existing conditions, and even for those that are new onset conditions. When we consider diabetes, it's now considered a chronic condition. The cost associated with care continues to rise as new and better treatment options become available. We think about the continuous glucose monitoring systems that are widely advertised on television, where someone can put a device on some place on their body, continuously monitor their blood sugar so they don't have to stick their fingers. Well, what about those individuals who do not have any insurance, or they have insurance that will not cover those types of devices? So therefore, they're constantly sticking their fingers to get their glucose readings, but they may, for whatever reason, not want to continue to do that. It's painful, it's inconvenient. And so maybe they're not checking as often as they should, which then likely they're not getting a true and accurate reading of what their blood sugar levels are, which then increases the other complications associated with diabetes. We think about obesity. Obesity is now classified as a chronic non-communicable disease and is linked to heart disease, type 2 diabetes, cancer, and even stroke. Okay, so treatment for obesity has also increased in cost and also in risk. We have to think about those individuals who need to go on maybe a diet and exercise regimen. Remember that many people are living with a decreased wages and decreased earning. So to eat healthy and nutritious meals is a increased cost. In addition to that, maybe they may not have the availability to go to a gym and work out in a structured setting. We have to think about those social determinants of health. What is the build like? What is your community like? Do they have sidewalks? Do they have places where they can go to for recreation and things like that? And then we also have to think about respiratory diseases. These are linked to environmental factors as well, which include pollution and then environmental chemicals that can be either in the workplace or in the home place. And then we also must consider tobacco use and the the effects of secondhand smoke on respiratory illnesses and respiratory diseases. So these individuals have multiple risk factors and often have the lowest level of resources. So consider your social determinants of health we discussed in an earlier lecture. I want to draw your attention to box 9-5 on page 231 in your textbook, where it talks about the social determinants of health. However, we should consider the impact of these non-communicable diseases on individuals when we make, and they can make an inference to its impact of on the population of health in the population. So if you think about it individually, yes, all of these things have their impact, but look at that at a larger level, like at a community level, or maybe even at a national level, even at a global level, where we're thinking about all of these factors: cardiovascular disease, cancers, chronic respiratory diseases and illnesses, diabetes, obesity, how these things are affecting your community. So risks for cardiovascular disease include, of course, high blood pressure, obesity, tobacco use, high cholesterol, and the low levels of physical activity. Remember, the heart is a muscle. If you don't exercise the muscle, then the muscle gets weak, and then you're going to have other issues. Risk factors for cancer include a combination of behavioral factors. Example would be like indoor tanning beds, secondhand smoke, alcohol use or tobacco use, but we cannot discount the genetic factors. Remember, there is some genetic predisposition that has been identified through gene therapy, that there is a link between heredity and development of some forms of cancer. Environmental factors, for example, we have to think about carcinogens in the workplace and even carcinogens in things that are in the home, pesticides and things of that nature that could potentially increase individuals' risk for developing cancer. Your breast cancer example, this was in your textbook as well. Increased breast cancer rate, all three levels of risk apply. These include family history, diet, exercise, reproductive history, alcohol use, and then these are all associated with an increased risk for breast cancer. So if you look at this circle and how each one of those things, your lifestyle, estrogen, age, alcohol use, family history, and reproductive history, all somehow touch each other and increase exponentially that risk for breast cancer. Chronic lower respiratory disease, we're talking about COPD, chronic emphysema, chronic bronchitis. Risk factors associated with that are smoking, abnormal inflammatory responses in the lungs to noxious particles, and those could be things in the workplace, but also in the home. What is that home build looking like? And I keep coming back to that social determinants of health. What are those things that we have identified in society that has a great impact on someone's level of well-being? Okay. Diabetes, growing in prevalence, of course, we know that 1 in 3 who are born in 2000 will develop diabetes in their lifetime. That is profound. But there are other individuals, even those younger, are also developing diabetes, type 2 diabetes, at an alarming rate because of inactivity, nutrition, eating habits, other behavioral things that can affect diabetes. So interventions to reduce the type 2 risk would be including exercise, eating healthy, maintaining a healthy body weight, and encouraging people to get out and walk. Prevalence of diabetes, we've just talked about that, and changes in lifestyle, especially in exercise and diet, and how these things can improve their survival rate and also decrease the A1C. Okay. So environmental factors that we need to consider include those pollutants. They increase risk for asthma. They increase risk for cardiovascular health problems. They increase risk of cancer. And the places where we can find these pollutants include in the home, in the workplace, in the air, in the water, in the ground. Hence the reason why it is so important for us to understand, like, what does the things in the environment do to affect our health and the health of our population. So this is the Environmental Protection Agency that the federal government has put into place to look at these things, like, are businesses putting too many pollutants in the air, in the water? Are they securing tanks and things like that where they have to store things in the ground? Are they leaking into our ground water, or into the soil around us, or in communities and things like that? And how are these things impacting people's overall health? So we talked about some behavioral risk factors. This is here again, nutrition, exercise, getting the obesity under control. It says these risk factors are higher in southern U.S. We have to think about cultural components. Remember that family is very important, and especially in southern families, they spend a lot of time together. These are the times when they come together as family groups, and they eat together, and they have large family gatherings. And a lot of times the amount of food that they eat is not going to be conducive to um, weight loss. As a matter of fact, it may even contribute to obesity. What types of foods are they eating? Think about the social economic impact, and how maybe the amount of food, they don't have the amount of money to purchase all of those healthy food items that research has shown or supports a healthy eating habits and healthy lifestyle that would reduce high cholesterol and high blood sugars, and all of those types of things. And then we have to think about the barriers for lifestyle change. Is everyone on board with that whole lifestyle change thing? So you do have to take those things into consideration as well. Behavioral risk factors include also tobacco use. We talked about cancer and pulmonary disease and cardiovascular disease. We also talk about alcohol use and how injuries associated with that have more than increased. And we're not just talking about the injuries to the body and the body systems, to the liver, to the kidneys. And we also have to consider injuries associated with alcohol abuse, on the job accidents, motor vehicle accidents, things of that nature, that can lead to disability and chronic conditions. So evidence-based interventions that we can use to reduce these risks include reducing individual risks. So educating individuals about those things that are associated with non-communicable diseases and their development, and how these things can lead to chronic conditions. Encouraging behavioral changes, improving access to affordable health care, and improving access to resources, and also providing information to individuals about resources that would be available to them. A lot of times it's not an issue of the resources not being there, but the problem is that individuals do not know what resources are available to them. Also thinking about what kind of funding can we try to achieve so that we can make those resources more readily available, especially to those people in the rural areas who may not have the transportation to get to the healthcare centers that they need to get to, or to the doctor's offices for uh, care. So our chronic care model here, this is also in your textbook, talks about the community and resources and policies to help with self-management, and then healthcare systems that can organize healthcare and have better care delivery systems, better decision-making support, and better clinical information, so that they're gathering the data, determining what is a level of non-communicable diseases and chronic illnesses within your particular area, so that they can put in place those things that need to be there to improve outcomes. So what's your nursing role? Nurses play a significant role in reducing these burdens through primary, secondary, and tertiary interventions. And I'm going to encourage you to go through your textbook and look at what are primary prevention things, what are secondary levels of prevention and interventions that we can do, and then what are tertiary ones. So treatment and prevention cannot be, now remember that non-communicable diseases cannot be prevented or cured through a vaccination or medication. They are those things that can be managed once they occur, so that they do not develop into chronic conditions. So it requires some healthy lifestyle maybe and changes, early diagnosis and treatment, and then also long-term management, so that even if they do have non-communicable diseases and chronic illnesses, that they can improve their quality of life by managing those things. So your World Health Organization says that actions to reduce the burden associated with non-communicable diseases include a comprehensive approach requiring all sectors, including health, finance, transport, education, agricultural planning, and others, to collaborate to reduce the risk associated with these. So they want to promote strategies that are going to be preventive. So we want to prevent things before they get started, and then all of those primary prevention strategies are going to be extremely important. So care delivery. So the Affordable Care Act wants to focus on chronic disease, the chronic care model. So we're going to decrease mortality and morbidity rates by making sure that people have access to health care. They have access to screening. They have access to uh, medications and things like that. They want an integrated care delivery model so that every person or every entity is at the table to make a better integrated system where that care delivery model addresses multiple areas. They want to focus less on the acute care model because we want to really focus on prevention. Their integrated care delivery model is one that addresses long-term care in the community, secondary and tertiary prevention activities. So remember, like non-communicable diseases, these are things that are can potentially be chronic. They have a very large impact economically on your systems, healthcare system, healthcare costs, and things like that. We do have to think about the genomics and the risk for communicable diseases, non-communicable diseases, and think about the things that are hereditary. Okay, genetic risk factors that predispose an individual to certain environmental and behavioral risk. They give an example of the BRCA and BRCA2 gene mutation. These were known as tumor suppressors that increase the risk for breast cancer. And this was in a study. This is in your textbook as well. If you want to go look that up and have some extra information. But think about those things that are people who are predisposed to certain things just by virtue of their genetic predisposition or their genetic makeup. So we talked about disparity in non-communicable diseases and then the socioeconomic risk associated with it. Remember we said that those who are at greatest risk have the least amount of access to resources. So on the flip side of that, we can think of those at a higher income level or higher socioeconomic status are going to have better health because they have access to those things. So we need to be able to close the gap and try to bridge those services so that the poorest of the individuals can also have greater access and have improved outcomes. We want to increase education. So lower education levels are linked to poor health outcomes. If people don't know, they're not educated about certain things. And this speaks to the concept of health literacy. We also want to look at our environmental factors. Remember that we need to have clean water, clean air, healthy workplaces, healthy places where people can get out and walk and exercise. Communities and roads need to be fixed, and so that there's sidewalks and things like that that can help to promote good health. Employment and working conditions. If we have better working conditions, we can mitigate some of those environmental risks that are associated with things in the workplace, like environmental hazards. We can also have maybe even employer increase their healthcare coverages and access for preventative care and preventative measures, things like smoking cessation, weight loss programs, exercise programs. Many workplaces are offering those kinds of things too. And then increase some of the social support for families to link them to better health and educate them about the importance of doing things that are going to help with their health care. Social economic risk, we talk about the cultural factors. Remember, they said that individuals in the South may also have an increased risk for a lot of the non-communicable diseases. And this has to do with the whole idea of how we come together as a community. Personal behaviors and coping skills, balanced eating, keeping active, eliminating smoking, so smoking cessation, educating individuals about alcohol consumption and how that can lead to long-term chronic illness, dealing with life stressors and challenges that affect health. So if they're stressed constantly, that's also leads to increased problems with blood pressure and cardiovascular disease and things of that nature. Improving access to health services and the use of those services to prevent and treat these chronic diseases. So if we can increase healthcare access for individuals, then more than likely we can also decrease some of the effects of these long-term and chronic illnesses. We do want to decrease the disparities between non-communicable diseases when we talk about gender. So men and women suffer from different types of diseases at different ages. So educating them and to understand what is the impact for a woman who may consume more alcohol than a man. What is the impact for women when it is related to heart disease, cardiovascular disease, type 2 diabetes, and the like. So that's going to be really, really important. When you think about the ethical dilemma associated with non-communicable diseases, there is a central risk factor. So lack of access to healthcare, including preventative screening, early and ongoing treatment, resources needed to manage care. So when we talk about that, we're thinking about, and the book speaks about access to care, and I make the statement again about those at greatest risk are the ones that have the lowest access to those types of resources that can help to mitigate some of the risks associated with non-communicable diseases. For those who are unable to obtain adequate insurance or those who do not have adequate transportation services, care is often delayed. So if they're not getting early intervention, not doing early preventative maintenance kind of things, not doing screenings and getting immunizations and getting screenings for heart disease and diabetes and obesity and all those other services, then when they are seen, it is usually much later, and then these diseases have progressed to the point where they're chronic now, and then this increases their healthcare costs and it decreases their quality of life. So these are the things that we do have to think about and how we can help individuals to move forward and do and get better access to care so that they can have better outcomes. So that is my lecture. I'm hoping that it all recorded well. If you have any questions, do post them in Canvas in the appropriate site. So have a good day and thank you for listening.